common question we receive in the clinic is, how do we test if a C1 is misaligned? And that is a great question. I'm going to cover that today. But a couple things that I want to note first. Number one is there are many ways to get to a desired outcome. There is not just one way, so I'm going to present one way. The other thing is that oftentimes we complicate things. Sometimes it's just too complicated. It can be much more simple, and that is a perfect example when we are looking at a C1 misalignment. When a C1 is misaligned, there is neurological interference to some degree. And therefore we can test it because we can do neurological testing, and that is the way that I find out if there is a C1 misalignment, because I find that neurological interference. Now, there are different ways to look at neurological interference. We can look at muscle or motor function, we can look at reflexes, and we can look at sensory. For me, the most common and best way that I use is the motor function or muscle testing. Some people will ask, well, why do you not x-ray to look at C1? Well, again, that complicates things for me, and that is okay. Some people choose to do that, and there is nothing wrong with it. Again, there are just multiple ways to get to a desired outcome, and I think that that is a great technique. I teach practitioners how to adjust C1. I teach practitioners how to identify C1, and what we're doing for many people is making it unachievable and inaccessible. So we want to make it much more readily available to patients, and that's why I teach a more simplistic strategy to checking to see for a C1 misalignment. And this is how I do it. We do muscle testing. So what I do is, for example, if I'm testing the neck, a common muscle that gets inhibited when the C1 is misaligned is the SCM muscle. So I will brace the patient from behind, something you can always try at home, but be very gentle. Down, we turn, and what happens is I have the patient pushing forward into my hand, and I match that patient. It is not me versus them. I match that patient. I apply some overpressure, and when a person has a C1, I can apply that overpressure, and that muscle starts to give way with a degree of impairment or what would present as a weakness. Now, this patient does not, and that is great because they don't have a C1 misalignment. The other strategy we can use is we can look at the shoulder, the supraspinatus muscle. And what happens is if they push up to, I'm going to lower that down a little bit. If they push up to the ceiling, push up harder, 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 and we can match, and with some overpressure, they can hold. We know that there is no neurological interference. But the majority of C1 patients will have those muscles being impaired, especially depending on the severity. C1 has the ability to inhibit many structures, which is what I cover in my courses. But for the sake of this discussion, which is very simple in an overview, those two muscles are common muscles that we are looking for to see, is there neurological interference? Is it coming for the C1? And then we will be treating it to confirm our findings. And that is how we assess C1.